Hello, everyone, and welcome to this webinar on practical application of disability inclusion in safeguarding practices. I am Dr. Eleanor Wadinobi. I'm the Senior Advisor of the Nigeria Resource and Support Hub. I'm a medical doctor and also an international health, women, peace and security, gender and human rights expert. I'm also currently the president of the Medical Women's International Association. Before we start this webinar today, please allow me to share a few points on housekeeping. First, to let you know that you are all on mute with your videos turned off. This is simply to support with the quality and connection of the webinar. Please be aware that we will be recording this webinar to share on the online hub afterwards for anyone who was not able to join. Be reassured that your names will not be visible. We will end the webinar with a Q&A session. And if you would like to ask any questions during the presentation, you can find the Q&A function in the controls panel at the bottom of your screen. And then you can add new questions or upvote any existing questions, and we will answer them at the end. Also, to let you know that closed captioning is available next to the Q&A or record button with the initials CC, depending on the configuration of your device. We are also hoping that you will have a sign language interpreter to join in the webinar. In today's webinar, we will be looking at the practical application of disability inclusion in safeguarding practices. And in order to do this, we've invited 3 speakers who will talk us through each key part of this webinar. So it is with great delight that I introduce first Lucy Muchiri. Lucy works as a technical advisor for social inclusion for site savers in East and Southern Africa and based in Kenya. Lucy has worked in both emergency and programming and has over 11 years working experience in different local and international organizations, including Child Helpline, Humanity and Inclusion, Catholic Relief Services, and Site Savers International. Part of the roles she has undertaken include a role as a safeguarding focal point where she supported programs in different countries to put up safeguarding mechanisms. She currently supports the Resource and Support Hub program in ensuring that the products are inclusive. Welcome, Lucy. We also have Tushita Mukherjee. She works as a project officer at Site Savers in Rajasthan state of India. Her academic training has been in human development and childhood studies, and she has had a varied experience of working with historically marginalized communities across India. Her commitment to human rights has become stronger through the work she has done in areas such as sexual and reproductive health rights, abortion, gender-based violence, disability, education, livelihoods, and empowerment. Tushita has supported the partner organizations in training and developing their respective safeguarding policy. a warm welcome to you, Tushita. We also have with us Richard Musisi. Richard is the Executive Director of Masaka Association of Persons with Disabilities Living with HIV and AIDS, MADIFA. Richard has a bachelor's degree in development studies and a diploma in mobility-based rehabilitation. Richard has over 12 years' experience in promoting and advocating for the rights of persons living with disabilities, with high support needs, such as deafblind children and people living with disabilities and living with HIV and AIDS and tuberculosis, as well as youth with disabilities. Richard has carried out his work in the Greater Masaka sub-region of Uganda. He focuses on equal opportunities and rights on access to employment, health, livelihoods, independent living, and participation in community development amongst persons with disabilities. So, to our dear participants, you have heard just a very brief and short bio of our erudite and esteemed panelists. It's time now to hear from them. So let me hand over to Lucy Muchiri.
Thank you very much, Elena, for the great introduction. As you have, my name is Lucy. I'm going to, together with my colleague Tushita, we're going to do a presentation on the practical application of disability inclusion in safeguarding. And we are going to be focusing a lot on the approach that SiteSavers uses for disability, for safeguarding. Next slide, please. So as many studies have been done by different organizations, we have WHO, we have National Society of Prevention of Cruelty Against Children, and we have Plan Internationals who have all carried out studies on the risks that persons with disabilities face in regard to safeguarding, and we have found that persons with disabilities are at higher risk of abuse, neglect, and harm. And this is particularly so for women with disabilities, who are 10 times more likely to be victims of sexual violence, and children with disabilities, who are 2.9 times more likely to be victims of sexual violence. This is even worse for children with persons with intellectual impairment, whose probability goes up to 4 times more than the rest. And it's even worse because most of the reporting mechanisms are not very accessible for persons with disabilities. So persons with disabilities are less likely to disclose the abuse, despite the higher risk that they face in terms of abuse. Next slide, please. So SiteSavers works in more than 30 countries in the world, and we work in some of the poorest parts of the world, which makes a lot of our beneficiaries very vulnerable to abuse. And our work focuses on eliminating avoidable blindness and promoting the rights of persons with disability, people with disability. And we focus on protection of sight, fighting disease, disability rights, and research. And it is for this reason, because of our work with different populations, that we find it necessary to really commit our safeguarding mechanisms to addressing also the needs of persons with disabilities. So next slide, please. Our SiteSavers is very committed to recognizing the risks that children and adults with disabilities face in terms of safeguarding. And because of this, we have made sure that we work with all our staff and programs to make sure that our everything that we do in everything that we do, we assess, we address, and we monitor the risk of harm, exploitation, or abuse facing people with disabilities within the programs that we work. We also make sure that we explicitly communicate our policy to all the staff and beneficiaries that we have, including those with disabilities. And our policy is made in such a way that it is accessible for all persons. It is accessible for all persons. Besides this, we look at, we think about the stereotypes and the cultural norms that people with disabilities experience that put them at a greater risk of abuse and exploitation. And so we consistently challenge these stereotypes and look at them throughout the safeguarding mechanisms. Next slide, please. So the things that what we are doing to make sure that we address this disability inclusion within our safeguarding, we look. First of all, we have a policy. Of course, like every other organization, we have a policy. Our policy is guided by the United Nations Convention for the Right of Children and the UNCRPD. Both of these recognize the risks that people with disabilities face. For the UNCRC, of course, the children with disabilities and adults with disabilities for UNCRPD, as well as children with disabilities. So we use this. In our policy, we outlined the broad safeguarding approach towards disabilities, but we also include specific actions for adults and children with disabilities that we are working with. Our mechanisms also include we have a safeguarding manager who manages the whole safeguarding unit, and alongside the safeguarding manager is country designated leads. These country designated leads are trained in safeguarding and also in disability inclusion within safeguarding, and they are charged with the responsibility of making sure that they disseminate these trainings to everyone within the programs. That includes our program partners and our staff as well. We also have a Speak Up system. This is an accessible online and phone system, and the Speak Up system is accessible to all persons. It's made in accessible formats, and it has 100 languages, so that people within different countries, within different who speak different languages, can be able to access this system. And the online and phone options make it even easier for more people to be able to access the system. And this includes for all people to be able to access the system. So staff also are made aware of their role in safeguarding at all times. They are trained in safeguarding alongside disability inclusion. They are trained in safeguarding, and they are made aware of their role in the field level, and also of their role to inform partners and support partners to make sure that they are also safeguarding the beneficiaries that we work with. To include persons with disabilities, we consult regularly with organizations of persons with disabilities and include them in our program. And even in our safeguarding mechanisms, we try to make sure that whatever we are doing, for example, if it, currently we are creating posters on safeguarding, and in the posters we are making sure that we are reaching out to the organizations of persons with disabilities that we work with, so that they can give us their input and tell us whether these mechanisms that we have are accessible to to them and to other people with disabilities. Each country also has a context mapping. The context mapping is a mapping of all safeguarding response mechanisms, response systems that may be in the country. So any response mechanisms that may exist in the country, within the country, that that we are operating. So this context mapping also includes the services that are available for persons with disabilities. So this helps our staff in the field to be able to know whenever they find a protection issues or an issue of safeguarding, to be able to know who to go to in that specific country. So that's it on my side. I will pass it on to Shita, my colleague, to continue from there. Thank you. Welcome.
Thank you, Lucy. And before I begin, I would just like to tell everybody that we are taking questions in the Q&A. Somebody had written in the chat. So feel free to write in the Q&A and we'll take it up after the presentation is over. So Lucy set a very good start of the session. Why safeguarding policy is so important. So I will just quickly go through how we can, integrate certain processes in our program so as to ensure that safeguarding is taking place. So like in Site Savers, we have a proposal guide for safeguarding. So across all programs, whatever we are planning, we will integrate all the safeguarding points, either be any activity or any proposal that we are developing. So for that, we have a program reporting checklist. So this checklist is basically, it helps us, like it helps any organization to have a very inclusive safeguarding practice. All aspects of inclusive reporting mechanism. There are checklists on capacity building for staff, action plan, what all things you need to do to ensure there is safeguarding, and a feedback mechanism as well. Then we also do partners due diligence. Can you please go back to the previous slide? In the partners due diligence, when we are partnering with any organization or hospital, we go through lots of processes. We also see whether they have safeguarding or not. So in the last 2 points, if a partner does not have a safeguarding policy, sometimes they have a policy on sexual harassment or a policy on child safety, but mostly it is not very comprehensive. So we help and we guide the partner. We have a proper document. We provide training to the partner, how to do safeguarding. I mean, how to ensure that you have the policy in place. And if a partner already has a safeguarding policy, while we are partnering with them, we have a set of checklists and we use the checklist to see all the points covered or not. Can we go to the next slide, please? Yeah. So when we talk about inclusive approach, we are talking about including everybody. And because Site Savers focuses a lot, our work is for the people with disabilities. So we have to see all the things are included. And we do face a lot of challenges, which you will also face while working towards ensuring safeguarding in organizations. There are budget constraints, definitely. So when we are program planning, if at the planning stage, all the safeguarding activities are included, it will be better. You might face a problem where safeguarding leads are appointed, but the training is not up to the mark. It does not have a lot of inclusive approach. It may be a generalized safeguarding training. So this is one challenge. And most of the times, when you select a safeguarding lead, you might see that the person may not be a person with disability. So they may not have any lived experience of disability. So it might discourage a lot of other people who have disabilities to approach the safeguarding leads and talk about their issues. So we need to ensure that there is representation from different people of different disabilities as well when you're selecting a safeguarding lead. Another challenge is that most of the times the policies and reporting processes are just in one or two few languages. It is so important, if you want it to be accepted by all, it needs to be translated into the local languages that are used in that particular area, where partners, consultants, your program staff can easily understand. And all these policies must be in accessible format. We often forget people with blindness. There are so many screen readers available. There are different formats which can be used by person with blindness to read the policy properly. So that challenge needs to be checked, really. So can we go to the next slide? Yeah. Some of the successes why we are pushing that the safeguarding policy that our organization adopts should be inclusive, because when you're working with persons with disabilities, they need to feel safe. People with disabilities need to feel represented in the policy, and they can frankly speak out. I mean, the policy is for them as well. And when this policy is usable, people, especially people with disabilities, they will feel very empowered and respected and heard. Respect is the center of it all. And with this, an aware culture will culminate in the organization that this policy is just not on papers, it is very usable, it is for all. So with this, I end my presentation. Thank you so much.
Thank you so very much, Lucy and Tuchita. Really compelling statistics there, and reminding us that we need to consistently challenge stereotypes and cultural norms, which I'm sure requires quite a lot of courage. And of course, the issue of contextualization, ensuring context mapping in each of our countries. Thank you also to Chita for reminding us of the integrated processes that you use, and sharing some of the challenges which I'm sure a lot of our listeners can identify with. And with that, I will now turn over to our third speaker, Richard Musisi. Thank you. You're on mute, Richard.
Like I say, thank you, Elena. It's my pleasure to share experience of MADIFA on how we've been practicing safeguarding. Next slide, please. MADIFA is an association of persons with disabilities working on HIV and AIDS, and also working on TB among persons with disabilities in Masaka, in Western Uganda. We also focus on healthcare, social and economic barriers, where we need to see that there are people with disabilities, when they go out, they don't experience those kind of barriers when they're doing their work. We do our work through peer support approach to reduce on stigma and discrimination within the community. The next slide, please. Our MADIFA, the first time we heard about safeguarding, that is when we started working with AD International under the Inclusion Works project. During the due diligence, that's when they mentioned about that, about safeguarding. And of course, as it was new to us, none of us thought about it, that maybe, but of course we were thinking about that maybe it is going to be a security guard. We are going to provide security guards or put up cameras so that we can see, that our members are safe. But of course, with the series of training that we've had, with the help of AD International, we realized that these are the things that we are doing by that time. It's only that we only needed to do them maybe in the organized way, and also start documenting some of these things so that we ensure that people are safe. But of course, what we did, we ensured that, of course, this policy was not just to fill the requirements for partnering with AD, but also to help us to see that our representatives can provide protection, particularly to children and vulnerable adults, and include staff and other beneficiaries that we are working with, so that they don't get any form of harm. But also to continue understanding safeguarding concerns and issues. and also to uphold dignity, respect, and for children and other people within the communities. Of course, many PWDs are experiencing this kind of challenges and they are living in an unsafe environment. So we have to ensure that the environment they live in are safe and they are not in any way abused, but also to get guidance for our members and also leaders and all others to ensure that children that we work with are protected. Next slide. In the way to implement safeguarding, all the policies that we had established, we had to have a safeguarding focal person. And of course, we thought that because of it's very, very important, the executive director should be a focal person. But also on the board, we also to have a gender focal person and any person in the board is able to receive any complaint or any no one is able to report any case of abuse. Opportunities on our safeguarding to our members because it is a new concept. We needed to know more about it but also work with other partners through this kind of forums like this one, it's through virtual, but also even physical, but also again in the one-on-one interaction that we meet with our members. We ensure that we have programs are designed in such a way that our members are protected. Of course, when we like writing reports, when we are taking photographs, we ensure that we don't give we don't provide direct directions and even the names, the real names of these patterns that we are putting in our reports to ensure that they are protected and they are safe. Also, we have tried to establish a safeguarding reporting mechanism that can enable any member within our community to report any safeguarding concern. We also have actually from the community, where we have what we call community peer monitors. We also use other leaders, but also even the disability leadership structures, where we ensure that all these people are able to channel the way they can be restricted. Okay. Next slide, please. While implementing safeguarding, we've realized there are a number of challenges. Of course, one of them is that safeguarding is wider. It goes beyond the organization up to the community level. So when you find that it's really not everyone is aware of this information. So we have to disseminate this kind of information from the organization and also people to believe in you, that what you're talking and within the community are able to understand these concerns. Another, like safeguarding, again, when you look at it, it's a policy that which we had to come up with, but also had already established another policy on prevention and sexual violence, the peers. This group, they also have the similar information, but of course a little bit different. So we had to harmonize them and see that at least they don't contradict, and also people really understand them very well and able to use both of these policies. Then the response to safeguarding reports involves monetary costs, which are often not available. For example, Madifa is a small organization. It's just growing up. It doesn't have this kind of big budgets that can really can be available to cater for such concerns when they come up. And when you go out to the community, when you're carrying out investigations, and maybe you have to involve other partners like police. Maybe in Uganda, things are different. These government offices, they are not facilitated. So they would expect you who is following up on the case to facilitate them. And also for organizations which are growing like Madifa. Again, in addition to that, Safeguarding is very, very important. However, most donors and partners do not prioritize budgeting. When you come up with a budget on safeguarding, these are one of the things that they have to scrap off and say, you reduce this, cut this, cut this, cut this, those kind of things. But so you find it very, very difficult. But yet, if like you have a project which is related to prevention of abuses, then they can really support. But if it is other projects like this one that we do on HIV prevention, this project that we do on livelihood, sometimes they will not really appreciate that we need those budgets. There is also an organization which is growing again. We lack our internal capacity to respond on the increasing safeguarding concerns. Because like I said, it's very, very wide. For example, we need to you could find that you need to provide emergency medical support if like the child is raped. If you find that maybe a woman with a disability has been beaten up by the husband, you need to you need to provide all those like kind of support. But also you need to provide the shelter. And whenever we don't have those kind of shelters, then when it comes to legal aid, lawyers are very expensive. And of course, sometimes they say they provide legal aid. There are partners that provide free legal aids, but of course, facilitating them to go down to the deep in the villages to look for evidence and also to look to support these partners. But also, you also need to facilitate the victim to go to the court to provide to give evidence. So this is also difficult, but also even to report to police. All this involves costs that maybe we cannot be able to facilitate. So next slide. Even we are experiencing weak referral systems in our area. But of course, even in Uganda itself, other stakeholders and duty bearers respond to abuses against persons with disabilities. Sometimes they don't take it serious. They can also, you would find they are working on women, they are working on children, but when you bring in a case specifically on a child with disability, you say, maybe you go to an organization for people with disabilities. But you ask them, isn't this one a person that needs to get you back? So you find it's very, really difficult. But again, the worst is the corruption that when you report these cases to authorities and someone comes in with lots of money, we just go and buy these people, officers, you give them extra monies, and you find that these cases, the files disappears. And you find that men, they think that safeguarding is against them. But of course, again, you see that male staff now, they don't really interact with the females because of fear of maybe interfering with their rights. Next slide, please. May I have next slide? Let's go to learnings. Yes, safeguarding, what we've learned, it's a human rights issue that we need to appreciate that any organization has to work on it. It requires continuous refresher training and ensure compliance and implementation. So we need to provide budget to support reporting and investigation and follow up on cases of abuses. You find that staff members and other were not aware of safeguarding by the time it was introduced to us. But of course, it requires continuous training so that people know their roles and responsibilities that they have to play when they are to ensure that safeguarding is safe, is put into practice. Then the victims lack trust among the community leaders and also even ask the organization ourselves to air out those issues that are affecting them. So they have to ensure that you first have to talk to them with so much so that they gain a lot of confidence in you, then they open up. So I think I'll need to stop from here and I hand over to Elena for, thank you very much.
So much, Richard. Thank you. Thank you for sharing your safeguarding journey and how your Organization started with thinking that safeguarding was about security guards, and then coming to that place where you put safeguarding into practice and, you know, the vulnerable groups that you work with. And, you know, you've shared with us some very real challenges around budgeting, and then the mindset in the environment where you work. And talking about corruption and disappearing files, truly illuminating. So with that, I want to thank all our panelists for their reflections and you know, sharing practical applications. Can you hear me? Yes. Thank you for sharing your practical applications. And now it is time for us to take the questions. I can see quite a few in our Q&A board, and I'll just take them from the top. We have from Regina, great work by Sight Savers. Thank you very much, Lucy. How do children and adults with disabilities access the safeguarding system? Do the partners have systems that receive and respond to safeguarding issues? And what and how do these look like? So that's to you, Lucy.
Thank you, Elena. Regarding the reach to children, let me start with that one. All our staff are trained in regard to our safeguarding policy and our mechanisms for accessing safeguarding, our mechanisms for safeguarding. So whenever they go to the field, we don't only have the safeguarding leads, but there are also the safeguarding points at that point when they're in the field. So it is expected that they tell the children or the people that they are reaching out to that whenever they're having an issue, this is the person to report, and if this is the person who is perpetrating safeguarding issue, doing something, abusing the beneficiary, then they are told who to report that person to at all times during the field. So all our staff know that, and they communicate that. They are supposed to communicate that and at the field level. Regarding the safeguarding mechanisms for the partners, every partner, as Tushita had mentioned, is expected to have their own safeguarding mechanisms. So we support the partners to come up with safeguarding mechanisms where they do not have, and we also guide them to make sure that they are operationalizing their safeguarding mechanisms. Thank you.
Thank you, Lucy. I'll continue with you because there's...
I'm not sure whether Tushita has anything to add on that.
Okay.
No, I'm good. You said it perfectly.
Yes, thank you so much. I'll continue with you, Lucy, and certainly Tushita, do jump in. There's an aggregate of questions, you know, regarding how you can share the inclusive formats of the policies and what types of accessibility do you have to ensure, do you ensure when making your policy accessible? Faraja is curious, Lucy, to hear more about how the Speak Up system works. Is it accessible by everyone, including those living with various forms of disabilities? Also, are there other reporting mechanisms available that can be accessible by people living with disabilities? And a third question to put with that, Lucy, is to say more about the Speak Up system and share resources that, you know, explain about it. So we have questions about the Speak Up system and then the formats of your policies, please.
Yes, a lot of questions, but I must say this pickup system is also very new to us, but it is even the policies and the documents within this system, and also the safeguarding policies. Basically, everything that is created in Sightsavers is expected to be accessible. So even our formats, everything is screen reader accessible, and we are encouraged to create simple documents so that they can also be accessible for persons with intellectual impairment. So basically all our documents, the documents we produce at Sightsavers are screen reader, are accessible for screen readers, and are simplified for all for readers to be able to read, for all readers to be able to access. Regarding the pickup system, I would want to maybe refer. I will post the link to the speak up system, the Sightsaver speak up system on the chat, so that we can at least be able to clarify more about the system, if that is fine with you and the rest.
Thank you. Tushita and Richard, did you want to add to those questions?
I'm good. Yeah.
Okay, so to any of our panelists, this is from Ramadan, who says, to what extent do you feasibly think that safeguarding should not be a project, but embedded into running programs, hence not requiring extra budget, but being a part of the organizational culture? Explain why. Any of our panelists can see that?
I would like to take this question, and then I would request Lucy also to go ahead, and even Richard. It is feasible if we plan during the infancy stage of any program. Like if we are, for example, a very small example that say I'm planning for an activity for OPDs on rights and entitlements, and I've made a budget and everything. So while making a budget, while making any training program, small practice like we can include sessions on safeguarding, we can talk about it. It is very simple, actually. We have to talk more so that people hear more about safeguarding. Once we regularly keep talking about safeguarding, and the training, if we are taking 2-hour session, it should not be like a lecture. That training should be very interactive. If we want people to enhance their understanding on safeguarding. For example, when we do a lot of work around gender, all of our organizations, we focus a lot on gender sensitivity, on equity, equality. We do have that language. Even if an organization is not working specifically on gender, but we do start seeing things from the lens of gender, where we are seeing there is a problem, where we are seeing there is inequality, discrimination. Similarly with safeguarding, if we wear spectacles of safeguarding, we will start seeing everything from the perspective of safeguarding. And it is definitely feasible. I mean, it may not need an enormous amount of budget even. We can just incorporate it and enmesh it together. That's what I wanted to say.
Thank you so much, Tuchita. Richard, did you want to add anything to this question?
Yes, for me, I would want to, because what Tushita said, that these are things that are done maybe within office. But when what should be done that when someone is facing an abuse, how are you going to respond to this? You find that you need a budget that would facilitate you to go out to reach out to this person. There is no way you would say that you would there is no way you can't get a budget, you cannot get someone to go out. So you need to go to other stakeholders to engage them to see that you get this person is really supported. Like I've said that if like a girl with disability is facing abuse at home, how are you going to support this person so that he lives in a safer environment? There you need to go maybe to look for a shelter. Maybe if he has been abused or beaten up, you need to take this person to a health facility so that this child is treated. All these things are not done for free. So we need some bit of logistics to incur. If like you've reported this case to police and maybe you have to go maybe to court, all these things it needs to, because this person needs to get justice. So all of those involves costs. So there is no way you would say that. So maybe if like you have a project that is related to that can help to provide that support. Like previously we've been having a project which is related to abuse, prevention of sexual abuse and among girls and women with disabilities. So we've been able to do all this kind of work. But if like the project is not there, how are you going to attend to this? And of course, so you find that in nature, and that's why I was saying that the donor, the partners that we are working with, they need to be flexible. If I put in a budget related to this, they should understand and say maybe because this is also a requirement that can be funded so that we can, so that it is, because it is a human right that needs to be addressed. So that's where, that is my take.
Thank you so much, both of you. You know, quite a few nuggets there. When Tuchita said, talk more to hear more, and that we should all wear the spectacles of safeguarding. And, you know, Richard said, you know, all these are not done for free. I'll go on. We do have from Laura Waters, I think. Hi, all in terms of disability inclusive referral templates and approaches, you can see, okay, she's sharing the child safeguarding toolkit Able Child Africa has developed. Thank you, Lauren, for sharing that with us. We also have from Claire Petit. Thank you for this detailed answer. Can you elaborate how you are monitoring accessibility and effectiveness? You mentioned that they are reporting mechanisms in sign language and Braille. Could you elaborate on this also?
Yes, definitely. So to monitor, I will also ask Lucy to take it. I'll just take a second. So when we mentioned, like I had written the answer to Claire. So basically reporting mechanisms, no, they are verbally explained to the beneficiaries, and basically there is a safeguarding feedback mechanism which we have developed, and it is shared to monitor the accessibility. So whatever data on usage is collected, it is reviewed and used to improve the practice. Like, for example, data that is collected should have how many reports are made by people with disabilities, how many cases involve people with disabilities, disaggregated also by gender, and then it is reviewed. And I will also ask Lucy to speak on it.
No, I think you've spoken well, Tushita. I don't have anything to add.
All right, let's go on to take some more questions. Thank you for your question, Sehe. What are the practices in relation to addressing persons with disability, particular people with hearing and visual impairments in terms of awareness/information dissemination, and to utilize available reporting and feedback channels? And I'll take that with Lauren's other question. What are the considerations for ensuring responses to incidents are disability inclusive? For example, how do we tackle ingrained stigma that means people with disabilities are not consulted in response processes, or are not even perceived to need or deserve the same response as other children? So we can take those two together, please.
So I will respond. I will let Tushita respond on the first one, and then I will respond on the second one.
All right. Sehai, I hope I'm pronouncing your name correct. So basically, as an organization, when we're working for persons with disabilities, it is in our ethos, it is in our value that we talk about all the issues that PWDs face, and for all persons with disabilities. The sensitization has to come in our language, in our body language, in the way we design our programs. So that is an ongoing process. And when we're talking about people who have hearing impairment or visual impairment, so how can we make it more accessible? We have different ways, like we have also shared before. Like, for example, for persons with visual impairment, we do need to ensure that whatever safeguarding activity we are doing, we have to see that persons with visual impairment can understand it and use it. The formats are in accessible formats. There are various screen readers, softwares that we need to ensure that they have. If they don't have, we need to ensure that there are audios available. You know, we can actually design different kinds of IEC and BCC materials fitting needs of different people. People who have hearing impairment, they won't be able to hear the audio, so there are pictorials and various, you know, visual aids that they can watch and learn. And for people who are unable to watch, they can use audio aids. So it's a very comprehensive thing, actually. And because we work a lot with persons with disabilities, in all activities we look at it from that lens. Even there are some projects that are on cataract, for example, but even there, like, for example, we are building a vision center. We may not, in that particular program, we may not be working directly for person with disability, but we do ensure that if somebody who has disability comes in the vision center, is it accessible to everybody? So what I'm trying to say is that in all programs, even if it's not talking about disability, our approach has to be inclusive. Like, we have to wear the spectacles of disabilities, like we wear the lens of gender, so that everything we see from the eyes of a person who has a visual impairment or a hearing impairment or an orthopedic impairment, etc. So over to you, Lucy.
Yeah, regarding the reporting, once a person with disability has reported, it is encouraged that during reporting and when a case is reported, every case is treated individually. So when we receive a case of a person with disability, it doesn't matter what kind of disability, we analyze what their needs are and we address it according to their needs. So this is how we make sure that every person with disability who reports a case is treated with the kind of respect that they deserve, and their case is addressed as an individual.
Thank you so much. We have requests. Did you have something? Yes, Richard, please.
Yes. Actually, on sensitization and creating awareness on safeguarding. For us at the community level, like I say, that we use what we call community peer monitors. These are people with disabilities and of different categories of disabilities. So we trained them about safeguarding, and they are able to reach so that they can transfer that information to other people, to other members of the same category when they go out there. And you find that they are always with them in touch. So when they reach out to them, they give them such information on safeguarding and how they can protect themselves. But again, these peer monitors, they also work as a reporting mechanism. When they hear, when they receive those cases from the community, then they report to us so that we can do the follow-up. But again, they are also engaged in the follow-up, so that if like at Madipa we have not responded, this person will keep reminding you that my case, you have not responded in this case. So you see that they are playing quite a big role to ensure that these people are safe and they know their rights and they are not abused in any way.
Thank you so much for, sharing that, the practical examples. And, I love the idea of the community peer monitors as well. Just to reassure some of you who have asked for materials. So we have, I think Asta has asked for the guidelines and checklists from Tushita. We have requests for materials from Olubumi. Just to reassure you that the PowerPoint presentations will be sent, and these additional links that you are asking for from our panelists will also be in your package. We're really racing now against time. So I sincerely apologize that we couldn't take all your questions. But let's see if we can quickly take one last one. Maurice says, is data being collected or rates of conviction? I think without this, there is a risk people with disabilities and others will not report, as well as other challenges and barriers. So here is a question regarding the incentive to report. Any comments on that from our panelists, please, quickly?
Yes, we have data. Regarding reporting, but this is not usually shared out because of confidentiality. So yes, we have data, and we use this data to inform us on how we should improve our system.
Thank you so very much. I really have to sincerely apologize that we have so many questions. And, you know, as with these sorts of things, time is just not on our side. That really is all that we have time for today. And, you know, it's for me to thank again Lucy, Tushita, and Richard for your very informative presentations, and to all of our audience for being so engaged and you know, for posing those challenging questions. We will shortly be sharing a poll with you. That poll has 3 questions. And we would greatly appreciate if you could complete it. This poll helps us to tailor our services to suit you and to continue to improve the events that we deliver. As I said earlier, we will be sharing the link to this webinar recording and the slides to you shortly, as well as other related resources. We've taken note of the additional questions. We've taken note for the requests for links, and we will do our best to ensure that these links are provided. And if you want to hear about future RSH webinars, I invite you to please subscribe to our newsletter. The link will be placed also in the chat. And now for a comprehensive guide to implementing safeguarding, please do visit the Resource and Support Hub Safeguarding landing page, where you can still continue the discussions. How about posing some of the questions that weren't answered for you today, so that they can be answered also online. You will also find the link to our landing page in the chat. And before the webinar, Zoom kicks us out rudely, allow me to say thank you very much indeed. Thank you to our panelists. Thank you to our participants. And we hope to connect with you again. See you soon. And all the best.